Video, we're going to go over the physician handoff and the care team lists. So the first thing we're going to do is we're going to go to physician handoff here. And if you see here, there's a spot where it says list and select a list. The things you can see on here is your care team lists or any patient lists you have selected. I'm going to go ahead and add a different care team list. To add a care team list, you'll go to these three little lines over here and select care team lists. And I'm going to choose one in Ventura, and I'm going to choose the critical care service, and we have one team available, which is the critical care team. So I'm going to go ahead and add that list to my options of teams to review. So at this point I can review any of these. You can select my assigned patients. So any provider can be associated to multiple different care teams, and you could have patients assigned on various teams, and any patient could be assigned to different care teams as well. We're going to go back to the critical care list and look at what we can see here from the physician handoff view. So from this view, you can see the patient and their location, their illness severity, their primary contact, and their diagnoses. If you click here on the little arrow, it will give you the IPASS, and so from here you can see some clinical data and the actions, situational awareness, and patient summary, and you can review the entire care team from here. You can also assign those, so I'm going to go ahead and do that on this patient, and you can put in a little action and click save. And then you could also add something to the patient summary, and you can add something to the situational awareness. These will print on the detailed list and are available on the IPASS that you can view on the workflow end pages, and then here on the handoff. So from here, other things you can do is you can add patients. This will bring up the patient search screen. One thing to be very careful with here is to make sure you select the correct encounter. So we're using this for inpatient, so you definitely want to use the inpatient encounter for that. And then the other thing you can do from here is print the list, and I'll just show you the options we have here. So from the printing, you can choose which patients to print and which to not print, and you can do the simplified view, and we'll look at that one, and it just has basically those things that are on the a simple handoff view there, and does include the code status, and then you can also print a detailed view, and you'll have to assign a relationship because there is clinical information on that. And this one takes a little bit longer to load, but you'll be able to see, so you can see the actions that need to happen and additional information that you've added in those other fields on this view. You can also change the primary contact from here, so that's good when you're signing off service or even on call for the night. And so you can assign all of your patients to a different contact. You can assign them to a different team, or you can assign them to a different contact. One thing to make sure is that you always want to select the correct team associated with that physician. Otherwise, they'll end up on the wrong list. So I'm going to go ahead and reassign the primary contact on all of these patients. And there you can see now I've reassigned that primary contact, and it's available for view on anyone who's reviewing the banner bar or the care teams. So this was just an introduction to the physician handoff and the care team lists. I'm going to do a few other videos on how to further manage these lists.